Hello, my name is Karen and I am an occupational therapy student at Kaiser University's MS-OT Bridge program. As part of my virtual fieldwork experience, I am creating weekly YouTube videos on various topics. This week, I will be explaining 4 different assessment tools used for a patient who was just admitted to a hospital after a stroke. I'll be describing these assessment tools as if I was speaking directly with my patient, Phyllis. It's important when you're speaking to your patient to use layman's terms or general knowledge terms instead of medical jargon. This way, the patient is sure to understand what you're talking about. Also, using language that they're familiar with and terms that aren't unfamiliar or scary to them can help put them at ease and let them know what to expect during your session. It's always important to also make sure that you're asking that they understood or have them repeat it back in their own words to make sure that they fully grasp what's going on. The 4 assessment tools I will be describing are going to be the range of motion, manual muscle testing, sensation testing, and the Kansas University Standing Balance Scale, or the KUSBS, for her balance. All right. Hi, Phyllis. So during our evaluation today, I'm going to be looking at a couple different things just to get an idea of how your baseline is right now. We want to see how you're functioning after your stroke, okay? The 4 different assessments I'm going to do are going to look at different things throughout your body: your movement, your strength, your sensation, and your balance. I'm going to walk you through each one. Alrighty? The first assessment we're going to be doing is called range of motion assessment. This is going to tell me how good you're moving by yourself and how you can move with assistance. I'm going to be looking at your non-affected arm, your left arm, to get a good idea of your baseline of how you normally perform. And I'm also going to be looking at your affected side, your right side, so that I can see how your arm is moving after the stroke. First, I'm going to be having you do the motions by yourself, and then I'll be helping you with the motions for what we call passive. This is just when I do all the work and you get to relax. We'll be looking at each joint: your shoulder, your elbow, your wrist, your forearm, and also your hands, okay? And don't worry, when it comes time to do this, I'll walk you through each movement and I'll make sure to show you how it's done. The next assessment we're going to be doing is going to be looking at your manual muscle strength. This is just a fancy way of saying I'm going to be testing how strong you are. Again, we'll be looking at both arms. That way I can get a good idea of your baseline and a good idea of how you're functioning on your right side after your stroke. We'll be looking at each joint again, and what I'm going to do is apply a little bit of pressure just to see if you're able to resist me, okay? And again, each joint we do, I'll make sure to explain it before we go into each motion, okay? That way you know what to expect. The third test we're going to be doing today is going to test your sensation. Sometimes after a stroke, people can have a little bit of a disconnect between their brain and their body, and sometimes your body isn't able to tell when something's touching you. You kind of lose that sensation. So what I'm going to be doing is applying different types of sensation to your arm, both sides again. We're going to be doing dull or soft pressure and also a sharp pressure, okay? And you're just going to tell me with your eyes closed if you're able to feel when I'm touching you or not, and if I am, what kind of pressure I'm applying, if it feels soft or sharp. The last test we have in store for today's session is going to be for your balance. All we're going to do is work on standing. Don't worry, we're not going to be walking yet. I'm going to get you sitting on the edge of the bed, and we're going to see if you're able to stand up by yourself, and if you can't, we're just going to see how much assistance you need with standing, okay? This is going to give me a good idea of how not only your standing balance is, but your sitting balance. This is important because without that balance, we can't really do the walking yet. So we need to start at the very beginning just to see if we can even sit up and see if we can stand up and how much you can do for yourself. Alrighty? Do you have any questions so far? No? Okay, I'm excited. As we go to each test, I'll make sure to remind you what exactly we're working on, alright? Thank you so much for joining me on this week's video, and I hope this clarified a little bit on how you can explain something that you might understand in medical terms, but making it something that a patient can understand too.